I would like to explain some of the tools that are available for injury management. I want to try to explain a methodology for assisting the injured worker in his or her return to gainful employment and assist in thinking through a return to work issues based on risk, capacity, and tolerance. This whole system, whether it's a functional capacity evaluation, fit for duty testing, pre-employment testing, all of it hinges on functional job descriptions. A functional job description is where everything has to start. The regular job description that you get is normally for HR purposes, for hiring. It tells the duties of the job. It is used in employee reviews. It describes the job. It may say that you have to lift 50 pounds. It doesn't tell you if you have to lift 50 pounds overhead, if you have to lift 50 pounds from one table to the other table with no bending. It doesn't tell you if you have to lift 50 pounds and carry it 100 yards, or if the 50 pounds is a 20-foot pipe that is 6 inches in diameter. It gives no indication of the dimensions, size, anything. It is typically useless when I get a job description for doing functional capacity evaluations. On the other hand, a functional job analysis involves assessing the employee, the work, and the work site. It is used as a validation of compliance with American with Disabilities Act, ADA, and other non-discriminatory legislation. So when you go to do a functional job description, the first thing that you want to do is collect the existing job descriptions. Read the job descriptions. You want to issue incumbent workers questionnaires for them to fill out, letting them identify some of the most physically demanding tasks in their job. Then you will sit down and you will interview some of the incumbent workers that have been doing the job, familiar with the job, and can give you the best information. You want to educate the employer and the person being interviewed that they should not hide anything from you, that you want to know exactly what they want, what they do on a daily basis, so that if things are too heavy outside of the norm, that management will become abreast of this, and ergonomic changes, policies for two-man lifts, all that can be discussed at the end. But for the purpose of doing a functional job analysis, you need to see exactly what they're doing, no matter how unsafe or that they think it is. So it's important to get them comfortable and get management comfortable with that. During this process, you're doing measurements and observation. You're watching the employees work, and then you're collecting data. You're collecting, if it's lifting, you're collecting the size of the object, the dimensions, are there handles, are there no handles, where the hands are when they start the lift, when they finish it, are they starting at the floor, lifting it to shoulder height, what's the frequency of lifts, how many times do they do it, can they take a break, is it time-based? All of these things are important. Validation of functional job descriptions is laid out by the law. Once you collect the data, put it together, you want the incumbent workers to review it, make sure that your terminology is accurate, the frequency of lifts is accurate, the weights are accurate, and then you have the supervisors and management review it for any changes. At this point, they can say, we don't want our employees to lift this much, or we had no idea that lifted. We can put an overhead hoist there. So it gives management the opportunity to make changes and lower the criteria if possible, which again protects the incumbent workers and reduces the risk of injury through this process. So corrections and editing will be done upon the agreement with the content. Once it's verified, this is signed. And from this point, you can design pre-employment testing using a validated functional job description. You can conduct functional capacity evaluations. You can conduct fit for duty testings for existing employees. And when someone is going to the doctor, if they got injured at home, injured at work, you have a functional job description to provide that physician so he can give accurate information on return to work. So a job description is what, as I said earlier, the typical job description is what the employer posts when he is announcing a job. It is used in HR. It's generally templates, and it may say something like, utilize a motorized hand jack to move materials from loading dock to the work area. Must be able to lift 40 pounds. Daily responsibilities include documenting the number of calls that came in. None of this tells you, how much material was loaded on the pallet. What is the distance that you're going? Is there an incline? Where did you lift the 40 pounds? So you really, really need functional job descriptions through a job analysis. A functional job analysis is also known as a physical demand analysis. It's much more detailed, and it describes all the movements that are the essential functions for that job title. It's the loads that a worker is likely to encounter performing the job. The tools to manage your incumbent workers, your new employees, are the foremost. If you start any of this, you have to start with functional job descriptions. This allows you to do fit for duty testing, pre-employment post-offer screens. And the beauty of pre-employment post-offer screens is that once you have offered the employee a job, it allows you to ask questions about pre-existing injuries, any workers' comp injuries that they've had in the past, any surgeries that they've had. So during their physical, we can expand testing to evaluate that area more thoroughly. So you're getting a documented range of motion values. Is there any pain during testing? Do they have any pre-existing conditions that put them at high risk for doing the job for which they have been offered? There are statistics that say 80% of the injuries come from 10% of the employees that were unable to physically do the job at the time of hiring. The next is functional capacity evaluations, as we have discussed previously. Ergonomic evaluations, workstation. Many times the hospital will call me if someone's having symptoms of carpal tunnel, thoracic outlet, tennis elbow, golfer's elbow, to look at their workstation to see if it can be modified to reduce their symptoms, keep them at work, and allow them to be productive. The employee is so thankful that the employer thought enough of them to offer these services. So generally, everyone is happy in this situation. And again, I'm excited about this. I was just certified this year in it, and I'm so excited about the philosophy behind this. But there is activity coaching through PGAP, which some people psychologically do not handle pain as well as other people. They call them catastrophizers. They may score high in fear, and PGAP gives psychometric measures to evaluate these psychological parameters, but it doesn't address them. I am not a psychologist. It uses activity. Once you do these and identify what areas are affecting the person, PGAP gives you a plan on how to get this person active and see that these fears may be unrealistic. So after the first meeting, we do not talk about symptoms anymore. We simply design activities that are well within their capacity, get them to fill out a logbook, meet with them once a week, develop a therapeutic relationship with them, and help them see that some of these fears that they had may not be grounded in fact at all. And statistically, this has helped hundreds of thousands of people overcome their fears. It's the most effective way for addressing delayed recovery that I've ever heard of. We also do back schools and safety talks. I've had calls where workers, two people tore their rotator cuffs while climbing down from equipment in the woods, and they wanted an evaluation. So went out there and evaluated their practices, and one of the loaders, instead of the truck driver climbing up the loader to get the slip to go to the mill, he was lowering it down on a string with a clothespin. So all he had to do was remove the note from the clothespin and no climbing. So we looked at 3-point contact, the boots, the wear on the tread, having excess stuff in the cab, bottles, food, keeping your cab clean, and then this practice which they instituted for all of their loaders to lower the tickets down on a string, so you never know what you're going to run into. A Fit for Duty is designed to be conducted on at-risk individuals, which are any individual who is physically unready or unable to perform the essential functions of their job. The Fit for Duty exams can identify and protect the persons from injury and the employer from their next workers' compensation claim. They're typically ordered after an illness. Anyone that's been off work for an illness may become deconditioned. They get back into the working environment. They higher risk of injury. They may not be able to do the job at all. After a work injury, a Fit for Duty is ordered when the physician provides the employer with a return to work without restrictions. The employer has the right to conduct a Fit for Duty test to ensure that the employee can safely do the essential functions of their job before returning on the work to the work site. And this doesn't matter if the individual was injured in a car wreck outside of work, or if they were injured at work. If someone's injured at home, they're unhooking their boat from their truck and they hurt their back and they want to come back to work, you don't want to let them back on the job site and then they hurt their back and it becomes a compensable claim. So in your policy and procedures, which each of these two national pre-employment companies provides you with all the verbiage, all the policies for using these tools, pre-employment, Fit for Duty testing, how to implement it in your policy and procedure manual, the letters that you issue your existing employees. All of these things are one big package. Post-employment Fit for Duty testing provides information on work-related deficits. It provides the employer with an opportunity to intervene before the injury occurs. A good example of this is a local company had an elderly man. He was about 70 years old, and they noticed that he had a couple of near misses while operating heavy equipment. So they ordered a Fit for Duty test. First thing they did was they documented the near misses. So they had documentation of the incidents of these several near misses. They sent him in for a physical examination. He could palm the floor. He could crouch, squat. He was in excellent shape. He was working because his wife's medication was $800 a month, and he was working for the medical benefits. At this time, we were doing driver evaluations for people with disabilities after a TBI or a stroke that were trying to get their driver's license. So we had equipment to test reaction time. So we did reaction testing on him. He failed miserably on the reaction time. So we just recommended that he did not operate heavy equipment. The employer was fine with that. They restricted him from operating heavy equipment. He went back to work. He kept his benefits. His wife got her medication. Everyone was happy. But the employer intervened before a serious injury occurred. That is what a fit for duty is designed to do. And according to OSHA, fit for duty means that an individual is physically, mentally, and emotionally able to do the essential task of their job that has been assigned in a manner which does not threaten their safety, the safety of another, property, or the public at large. That's as of July 18, 2016. A return to work program that involves transitional duty may also incorporate fit for duty testing to ensure that their employee is progressing along the clinical ladder as they should. A test is typically always administered, again, anytime a physician provides a medical relief for the injured worker to return to work without restriction. Now, post-offer pre-employment testing, this is a large portion of what I do. We've done thousands and thousands and thousands of tests, but it allows the employer, once a bona fide offer of employment has been offered to the candidate, they have the legal right to do a physical examination on this person, ask them if they've had any workers' comp claims, if they've had any car wrecks, have they had any surgeries, and legally you can expand testing to further evaluate whatever area was injured. So if they had a previous rotator cuff tear, you can do special testing to further evaluate that shoulder to help from re-injuring that shoulder. So if the person is strong, has no, the special tests are negative, they're able to lift everything, and they go to work after they pass the evaluation and they re-injure that shoulder, the employer can pull that up. They say it was a pre-existing injury for another employer. It goes on the state secondary injury fund, and it saves them money that way. Statistics show that 80% of the injuries that occur at work occur from 10% of the employees that were hired that were physically unable to do the job at the time that they were hired. That is what post-offer pre-placement testing does. It uses objective evidence of pre-existing conditions that establish imminent risk, the person's inability to safely perform the job functions are documented, then the offer can be rescinded, and it's perfectly legal. You're protecting the safety of that person, you are protecting the safety of other employees. If a disability is present, the testing helps establish if accommodations can be made. There's a checklist that you go through that is ADA compliant to see if any kind of accommodations can be made by the employer. So how do we think about work restrictions? How do you determine if someone is a work restriction is appropriate? And the best way to do that is to consider three things: risk, capacity, and tolerance. And risk refers to the chance of harm, again, to the person, to the general public, and if the patient engages in a specific work activity. When an injured worker should not attempt a certain activity because of a known risk, this is a appropriate time for physician-imposed restrictions. If he's done a rotator cuff surgery, he knows it was terrible, and this person should not be lifting cinder blocks over the head, that's the perfect time for a physician-imposed work restriction. A work restriction is something that the person can do, but they should not do, opposed to a work limitation. So maybe this person has had a terrible rotator cuff injury. They could put a cinder block up there. After going to physical therapy, they're physically able. But if they do this repetitively, they're going to end up tearing it again. So because of known risk and the task being inherently risky for that injury, a work restriction is appropriate. A work limitation is something that the patient cannot do. So you can look at it as an impairment. The person is impaired. They can't lift their arm over their head. If they can't lift their arm over their head, then putting a cinder block over their head is impossible. So because they can't even lift their arm overhead, this is a work limitation because they're unable to do it. A work restriction, they could do it, but they should not do it because of the inherent risk. So that's the difference in a work restriction and a work limitation. The light bulb came on to me when reading the definition of a functional capacity evaluation. And a functional capacity evaluation is using functional testing to assist in establishing whether there are functional implications to the injured worker's clinical condition. To accomplish this goal, the evaluator attempts to identify what the test attempts to identify what the worker cannot do, should not do, or what he or she will not do. So if you look at what they cannot do, that is a work restriction. If they can't lift their arm over their head, they can't do above shoulder level work. What they should not do, if because of their medical history, this task is inherently dangerous, that's a work restriction. Or what they will not do, then that may fall into the psychophysical area or lack of effort or catastrophizing or fear or whatever you may call it. And that FCE does not look at intent. All FCE does is document what the individual does on the day of testing. Everything is hinged upon that patient fully participating in the evaluation and giving their best effort during testing for the information to be useful for defining work restrictions, work limitations, return to work. So a FCE, again, looks at three areas: biomechanical, strength, range of motion, endurance, cardiovascular, and psychophysical, because any one of these three areas can hinder return to work. So risk. Does the activity present as substantial harm? So substantial harm is objectively verifiable worsening in the patient's condition, not merely an increase in present symptoms like pain or fatigue. So if someone gets fatigued doing something, then a work restriction may not be appropriate. Like 90% of the people that are doing sustained work overhead, their shoulders start burning and they get fatigued. That doesn't justify a work restriction. A work restriction is appropriate if it is inherently presents as a substantial harm based upon their medical history and their clinical presentation. Capacity, which is where a functional capacity gets its name, refers to concepts of strength, flexibility, endurance. Capacity is very scientifically measured, and it's the basis of a functional capacity evaluation. What occupational health nurses, physicians, vocational rehab, what they're all interested in is a person's current ability. What can they do at the time? Capacity is fluid in that you can get deconditioned from being off work. Your condition can be improved through returning to work or through programs like work conditioning. So capacity or current ability can increase. Where people normally get mixed up is on the concept of tolerance. And tolerance is a psychological concept. It's the ability to tolerate sustained work or an activity for a given level. That's your tolerance. Tolerance is not scientifically measurable, and it is variable. Most of the time, a worker's tolerance is way less than their capacity. And I've conducted over 1,500 functional capacity evaluations. With every functional capacity evaluation, we try to get an idea of the person's perception of abilities, and we'll ask them, what can you lift from your waist and put it in that cabinet right there? What can you lift from the floor and put it on this table? They'll say 5 pounds. When we do their functional testing, they may lift 50 pounds. And some of this may be that, hey, they've not attempted it, they may be scared. I really don't know all the reasons, but 90% of the time, the person's description of tolerance is way less than their functional ability. And tolerance is dependent upon rewards. A person that is self-employed may tolerate greater symptoms and return to work a lot quicker than someone that's not self-employed. And tolerance is exemplified when a worker maybe won't go back to a job because he says he can't tolerate it, but he gets a better paying job, he'll go and endure the symptoms for the increase in wages. So tolerance is a very difficult area. And if you rely on what the person is telling you, you can't make decisions based upon what the person is telling you. That's why functional testing, if someone is applying for disability, the law does not let you go on the person's description. They require functional testing. And functional testing is the only way to objectively define the individual's safe work capacity. So job site evaluations and job analysis. A job analysis uses the principles of ergonomics to analyze the components of a job specific to a particular employee. They use the knowledge of the employee's work limitation, impairment to see if any accommodation can be made to improve environmental barriers. If there's no barrier, there's no disability. I'll give you 2 good examples of this. A physician ordered a job analysis on a patient that had a rotator cuff tear. He was supposed to return to work. He kept telling his doctor there was no way he could return to work. The doctor hears this all the time. The patient is very adamant that he cannot. He orders a job analysis. I go out there, I hear patients say stuff, and I have no idea. I went out there, and I could not believe what this man was doing for a job. He would load pallets. He used a manual hand truck to lift the pallet, and he would get a coworker to take a golf cart and ram the back of the pallet with the load and try to pull it up a ramp into the warehouse. The frequency of lifts in the box, it was him and one other person, was unbelievable. And after conducting the job analysis, they ordered vocational exploration. They had to look for a different job. There was absolutely no way this man could go back to that job. Now, I had another lady that had a carpal tunnel release. She insisted that she could not return to her job. and a job analysis was ordered. And she worked in a place that she was supervisor, and she was the one responsible for determining benefits for individuals. And so when the individual came to apply for benefits, the secretary or clerk up front would put all of the data into the computer, where they live, what they did, what was their earning capacity, what was their last employment. And then when she met with the supervisor scrolled through looking at the data and determined what programs that she qualified for, and instructed the lady on the steps to do that. There was very little keying, very little computer work. I asked how could I get that job? It was unbelievable. But there were no environmental barriers that would preclude her from working in that environment or exacerbate her condition. Another lady that had failed knee surgery, again, was going to retire in 6 months. A job analysis was ordered. I went and looked at her job. She could park right by the door. It was probably 10 feet to get in the door. Once she got in the office, she could sit, and she could, the only thing that needed to be done in the office was the printer needed to be lowered and placed by the desk beside her, and she could make a copy of the driver's license, spin back around, and she could roll in the chair to a filing cabinet, and never really needed to stand unless she wanted to stand to stretch. And she was able to do that job with no restrictions. There was no disability because the environment didn't require that of her. So the environment determines the disability. If you have two physicians, and the patient is telling one physician one thing and telling another physician this thing, and you're trying to see what this person can do, the physicians may not agree on questions of tolerance. The best way to make a question is to stick to risk of harm. Is the activity an inherent or presents as a substantial risk of harm in the person worsening their medical condition? If someone has a knee problem and they're primarily sitting and their knee aches a little bit, they have some discomfort, and they can move their knee, that's not going to make their knee worse. It's not going to make their arthritis worse. I worked with a lady that had Harrington rods in her back for years, and she was in tremendous pain, and her face would be drawn, and then when you talked to her, she would brighten up. But her job did not cause any further deterioration in her level of functioning or any progression of her symptoms or her pain. So she would have been at pain at home or here, but this job that she had did not cause any deterioration in her level of functioning, and she could do it fine. So when there is no objective pathology, but rather only symptoms, and the symptoms are out of proportion to the physical examination, most physicians agree that working despite symptoms provides no risk. If someone has low back pain, they've had MRIs, they had EMGs, they're negative, there's no objective findings, there's nothing that they can find to substantiate the claims, then the question is, what condition can be made worse from doing the activity? So how can you do a work restriction that's based upon substantial harm when there's no condition that anyone can find that can make the condition worse? So a FCE looks at these things. FCE is a short, intensive evaluation that focuses on the major physical tolerance abilities, musculoskeletal strength, endurance, speed, flexibility. And again, it attempts to identify what the worker cannot do, should not do, versus what the worker will not do. Now, impairments. Impairments are based upon the 6th edition of the guides, and the guides define an impairment as a significant deviation or loss in the use of a body structure or body function in an individual with a health condition, a disorder, or a disease. A disability, on the other hand, is an alteration in the individual's capacity to meet personal, social, or occupational demands because of the impairment. So the impairment is what is wrong with the health of the individual, and the disability is the gap between what the individual can do and what the individual needs to do or wants to do. So disability arises out of environmental demands. So it's the demands of the environment that cause the disability. If there are no environmental demands, there is no disability. So if a job analysis specific to that injury can be ordered, if an ergonomic assessment to see if anything can be repositioned so the person doesn't have to reach overhead, can they use a step stool, if the environment can be altered, if the packages can be shipped in 20 pounds instead of 50 pounds, if the environmental demand goes away, then the disability goes away. So when you're looking at return to work, when you're looking at defining work restrictions, when you're considering pre-employment testing or injury management tools, these are some of the questions. Do I have an adequate job description? What is the patient's medical problem? Again, if it's something that is severe, then start planning early. If the person's not going to be able to return to their job and you need to hire someone to go back in their job, these decisions can be made early depending on what their problem is and what the physical demands of their job are. What are the objective signs of pathology? Are the diagnostic testing, is the MRI positive? Is the EMG, does the EMG show anything? The special tests done by the surgeon and the therapist, are they positive or negative? Are they all coming out negative and no one can really find an objective problem? All of these are questions. What are the patient's symptoms? Are the patient's symptoms consistent? Are the patient's symptoms inconsistent and don't match what we know about the human body and physiology? Are the symptoms permanent? Are the symptoms temporary? Will they get better? All of these affect transitional duty, work restrictions, and decisions made on return to work. Will this problem improve with time, medical treatment, or exercise? Which, return to work, if you can use transitional duty, start someone on light duty, get them back to work, then their standing tolerance may improve. They may get in better shape by returning to work. So work can be used as a form of exercise. How do you frame questions? If you have a person, an injured worker that has a meniscus tear, and there's no medical explanation why the person can't return to their job, if they have mild or moderate pathology and the pathology is not significant enough for the person to choose another career or to stop working entirely, then the push should be for a statement that there's no medical answer. There's no medical answer why the individual with a partial meniscectomy can't return to their job. The patient, no matter what they're saying, should not be certified as disabled. The disability should be equal to the impairment. So with a mild pathology, they should not be deemed disabled. The push should be for work restrictions or work limitations, and the questions should be framed in a biomechanical model in which severe impairment equals disability. So return to work involves job site evaluations, job analysis, functional job descriptions, functional capacity evaluations. For incumbent workers, you may have back schools, you may have talks on cumulative trauma disorder, on lifting. You can also order work conditioning prior to ordering a functional capacity evaluation. If someone's going back offshore, if they're a lineman, installing telephone poles, climbing poles, spiking poles, you may order work conditioning to get them in shape for their functional capacity evaluation. And again, ergonomic assessments to see if the environment can be changed to decrease the physical requirements of the job and to make workers more productive. PGAP, the Progressive Goal Attainment Program. I recently was certified in PGAP, and I am very excited about this program. I watched videos on it prior to attending the certification, and I was blown away by the concept of what they're doing. When I was in occupational therapy school, there was 2 schools of thought for someone that was depressed. You could do counseling with them. You could talk to them about their childhood and their problems and their current status, or you could deal with the symptoms of depression. People with that become depressed get withdrawn from their family. They become lethargic. They stay in their house and withdraw from seeing friends. They're less physically active. They're fatigued. And one of the ways they taught us to address it in school is that you can just start having the person get back into church, get back into their social groups, try to walk 10 minutes, get up and get your clothes on and get dressed. And by increasing their activity level, their symptoms of depression decrease. This is the same concept for PGAP. PGAP is designed for patients that are not progressing as they should along the clinical ladder. It's an evidence-based treatment program for reducing disability associated with pain, depression, cancer, and other chronic health conditions. It is used exclusively throughout Canada, and 90% of the providers in Canada are occupational therapists, because occupational therapists, by definition and training, focus on the life roles that were lost because of the illness or injury. The primary goals of PGAP are to reduce the psychosocial barriers to the rehabilitation process. Every time PGAP is ordered, they order it in conjunction with physical reconditioning. So the person should be involved in a reconditioning program at the same time that they are participating in PGAP. It's to promote reintegration into the life role activities, increase their quality of life, and to facilitate a return to work. So this person that is not progressing as they should would be assigned an activity coach, which is what I was just certified to do. And you meet with this person once a week, you develop a relationship with this person, and you give psychometric testing to evaluate, one, if they are candidates for the program, and then it identifies which area is hindering their ability to function in life. And then you develop activities that reduce their fear in participating in these areas. And you develop the activity that you are certain will not exacerbate their symptoms. So if they feel like they can do it for 45 minutes, you may have them do it 20 minutes to ensure success. And by taking these steps and doing more and more over a weekly basis, it has proven to be the most effective way for dealing with this population. The goals are achieved through targeted treatment. Psychosocial risk factors are evaluated. There's structured activity scheduling, graded activity involvement, goal setting, problem solving, and motivational enhancement. The key to the program's success is a therapeutic relationship between the activity coach and the individual. The treatment objectives of PGAP proceed from the view of return to work as the highest level of independence. This is supported by almost every study that is out there, that people have improved psychological health when they're able to return to gainful employment. And that can be offered to someone with debilitating health or mental health condition. Both of these populations can benefit from PGAP. PGAP is currently the most researched risk-targeted intervention designed to reduce disability associated with a wide range of health and mental conditions. It is considered the most cost-effective approach for reducing disability and fostering return to work in individuals who suffer from a wide range of debilitating conditions. There are over 6,000 PGAP providers that have been trained in 10 countries, and these PGAP providers are in Canada, the United States, New Zealand, Australia, United Kingdom, France, Sweden. Injury Management Service is now a PGAP provider as of 2018, and I am excited. Certifications. I've been certified as to administer the PAVE tool. PAVE tool was developed by WorkSteps, and it's one of the nation's leading providers of functional employment testing in partnership with the Bridal Consulting Group. PAVE stands for Physical Abilities Validation Evaluator, and it's a tool that is used to validate physical agility tests for a variety of jobs while being ADA and EEOC compliant. This tool is absolutely incredible, and it follows the steps that I mentioned earlier on doing functional job descriptions and doing questionnaires with existing employees, interviewing the employees, observing the task, measuring the task, validating the physical requirements, having them review your findings, the incumbent employees and the management, and ensuring that the tasks that are looked at are essential functions of the job. And this is a step-by-step laid out plan that ensures that when you get through, that it meets the uniform guidelines of Employment Equal Opportunity Commission and the American with Disabilities Act. It's bulletproof. The tool really automates the whole system and makes it extremely defensible for the employer. I've been certified as a behavior-based ergonomic specialist through a course by Richard Bunch, and it is provided by WorkSaver Employee Testing. I am a provider for WorkSaver Employment Systems Testing, LLC. It's a Louisiana-based corporation that specializes in employment fitness for duty testing. The fit for duty testing is conducted on new hires, post-offer pre-employment basis. It can be done on incumbent employees for cause per the EEOC guidelines. It can be done in intervals for high-risk jobs like firefighters, first responders, police officers. It can be conducted on transfers if you're going from the Gulf of New Mexico to a land rig. It can be done in return to work cases following an injury or an illness. The WorkSavers assist employers in developing EEOC and ADA legally compliant fit for duty programs by conducting job analysis referred to as job physical demand validations, or PDVs. The PDV encompasses interviews, shadowing employees, measuring the physical demand parameters of the essential functions of the job. Again, this is the basis of all testing. Prior to rollout for any fit for duty testing program for the employer, WorkSaver provides policy and procedures, including interactive accommodation procedures. If the therapist tests someone that has a disability and you want to evaluate whether or not there are accommodations, WorkSavers provides a step-by-step procedure for you to follow to ensure that you're meeting the letter of the law. They give that to you. They give you policy and procedures to put in your policy and procedure manual for fit for duty testing for existing employees. Employers are providing with very user-friendly online process to schedule job employees for fit for duty testing. They have just started a portal where you're going paperless. You can pull all of your stuff online. They have a nationwide network of certified clinics, and the testing statistics and return on investments is conducted and sent to each employer that starts the system. The founders of WorkSaver Employment Testing Systems is Dr. Richard Bunch. He's a PhD, PT, CBES, and he's the current owner and CEO. And Trevor Barberson, which is a PT. He has his OCS certification, and he is, again, a certified behavior-based ergonomic specialist. He is also president and co-owner. Now, WorkSteps. WorkSteps is another national pre-employment testing agency. They're one of the nation's leading providers in functional employment testing. Their tests are medically safe, legally compliant, scientific, objective, and specifically designed to match a worker's functional capacities with the essential functions of the job. All providers are trained, they're licensed, they're certified, and they're managed in a national network. If I test a candidate here for WorkSteps and someone in Texas tests a candidate, they should do the same test. WorkSteps proprietary employment testing has locations all across North America. It's standardized programming, training, exceptionally talented staff, and state-of-the-art technology systems make their program the best in the nation. WorkSteps is headquartered in Austin, Texas. They have standardized functional testing that is utilized by thousands of national and regional employees throughout the country. The WorkSteps program has become an integral part of an organized and systematic business model that is automated, validated, measurable, and offers predictable return on investment. Companies that begin WorkSteps experience a significant and immediate results, typically a 40 to 50% reduction in workers' compensation claims and related costs over the previous year, with continued reductions thereafter. The longer that you participate in either of these programs, the more cost savings you see as more and more of your employees have been through the system. Employers that begin utilization of WorkSteps program experience the following: decreased turnover. You are eliminating the candidates that could not do the job at the time you hired them. They're physically unfit. They wouldn't tolerate 12 hours in the sun or standing on asphalt. These workers never get there, so turnover is decreased. People that know that you do testing and they're injured or hurt may not apply for the job. You're getting employees that are capable of doing the job. You have increased worker productivity, a safe work environment. Everybody that you're hiring is able to do it. Reductions in lost time, diminished incident of fraud and abuse, because you're getting all these policy and procedures to handle all of that. You have reduced modifier rates and workers' compensation premium, and a reduction in group health costs. WorkSteps is a content-valid functional employment test that includes pre-employment post-offer testing, post-employment fit-for-duty testing, upper quadrant carpal tunnel testing. So there's a test if individuals are just doing fine motor tasks, dealers in a casino, screwing parts together in an air-conditioning factory. You can just look for signs of carpal tunnel, cubital tunnel, de Quervain's. You can look for people that are symptomatic before they get to the job. Return to work, fit for duty, functional capacity evaluations, post-injury. WorkSteps has performed millions of functional employment tests, has performed millions of tests since the company was fully incorporated in 1994. They have more statistical data than NIOSH has. Amen, brother. My name is Bruce Odell, and I kind of wanted to tell you how Injury Management Services LLC came into being. In 1994, I was working at Rapides Regional Medical Center in cardiac rehab as a clinical exercise physiologist, and I was teaching in the Diabetes Center as a certified diabetes educator. We actually went through the process of getting it ADA recognized, and I taught the exercise component in that center. My wife worked for a local physical therapy group that had 5 clinics, and we met, and they offered me the opportunity to come to work for them and start an industrial rehab program. In this offer, they provided a stipend for me to return to school in occupational therapy, and I talked to my wife, and we had just built a house, and we loaded our kids up, and we drove to Denton, Texas, and I enrolled in Texas Woman's University to obtain a master's in occupational therapy. While I was there, I stayed and did an extra 6-week rotation at Baylor in Irving, Texas, in industrial rehab, returning here and starting to work for the group in January of 1999. From that point on, the majority of my continuing education was focused on industrial rehabilitation. I lectured to the LSU medical students on the role of exercise in the management of diabetes. I provided educational talks to companies around Central Louisiana on cumulative trauma disorders, tendon entrapment, proper lifting. We did back schools. I met once a week with employees of Pepsi and did safety talks weekly. I lectured to case managers, nurse case managers, and HR personnel on how to interpret FCEs and the testing that was used to identify symptom magnification, how to manage workers' compensation claims as part of their continuing education. The services that we provided then were agility tests, post-offer pre-employment testing, fit-for-duty testing, functional capacity evaluations, functional job descriptions, and not least, but my favorite, work conditioning. And as an exercise physiologist, I love getting people in shape, and people that are going back to physically demanding jobs like offshore, or people that are working as linemen installing poles in the ground, putting cross arms overhead, have to be physically fit. And when you've been off for a while, a lot of times the employer will order work conditioning prior to doing a functional capacity evaluation to get the individual in shape before they test. They will score better and do better. So during this time, I became certified by the American College of Sports Medicine as a clinical exercise physiologist. Again, I obtained my master's in occupational therapy and a master's in sports science. I became a provider for WorkSavers pre-employment testing program, as well as WorkSteps pre-employment testing program, both of which are national pre-employment testing companies. The reason that we decided to use these national companies is that these nationally affiliated agencies, is that they provide training, they provide policy and procedures, as well as ongoing support for anything that you run into during pre-employment testing. And I promise you, every time that you think that you've seen it all, that day you will see something you do not know to handle, and you pick up the phone and you call somebody that is dealing with hundreds of companies around the United States, and they can walk you through what to do step by step by step, and you can walk the employer through what to do step by step by step. They also monitor any kind of Supreme Court decision, all new employment law, and they update and change how they do tests, and they change their policy and procedure manuals based upon this new employment laws or changes in the law. By 2004, I had become a certified functional capacity evaluator, a certified behavior-based ergonomic specialist. I had completed the essentials of AMA impairment training, therapeutic seating assessments, pain management certification through the University of Southern Indiana College of Nursing and Health Professions. I had been to McKenzie cervical spine and lumbar spine evaluation. But in 2004, this partnership that I worked for dissolved. And some kind of way, by the grace of God, Injury Management Services, LLC was born. I didn't know where I was going to work, but I knew, all I knew how to do was industrial rehab. In 2005, I completed a course on building an occupational health workplace consulting practice to guide my fledgling little company. I also completed water survival and helicopter underwater regress training and the Safe Gulf training through the Acadiana Safety Association in preparation for doing functional job descriptions offshore. I am currently located in a building, it's a new building with Elite Physical Therapy and Mid-State Orthopedic and Sports Medicine. We have a symbiotic relationship, really all of us. And if you wonder why occupational therapists are frequently hired to do industrial rehab, is that occupational therapist degree and training is to focus on the life roles that are lost through illness or injury. So we focus on the life roles that were disrupted, where physical therapists focus on the biomechanical issues such as strength and range of motion. Occupational therapy is a type of health care that helps solve the problems that interfere with a person's ability to do the things that are important to them. Physical therapists are biomechanical experts, and I have 6 physical therapists that are employed by Elite Physical Therapy, which each have their doctorate degree, DPT in physical therapy. They assist me if I need assistance with evaluation of a neck, a back, a hip, and I assist them by providing services for their patients as they are discharged. Their patients need impairment ratings based upon the AMA. They need work restrictions for them to return to work, or for the vocational rehab person to look for different type of employment if they're unable to return to their pre-injury job. I offer functional capacity evaluations, fit for duty testing, work site and workstation ergonomic assessments to reduce the risk of injury when their patients are returning to work. We all work together as one team. Mid-State Orthopedic and Sports Medicine is also located in the same building, and we have 9 orthopedic surgeons and 1 board-certified physiatrist that, among other things, does EMGs and nerve conduction testing. Once their patients reach MMI, they need impairment ratings based upon the AMA, work restrictions, disability evaluations, work conditioning, work readiness rehabilitation, and some of their patients that do not follow the clinical model of recovery may benefit from the Progressive Goal Attainment Program, or PGAP. PGAP is very exciting. It's an evidence-based treatment program for reducing disability associated with pain, depression, cancer, and other chronic health conditions. So when patients do not follow the normal clinical model, sometimes it may be fear, catastrophizing, these things, and they're not progressing. The PGAP system is a system that is structured, that provides an activity coach that helps these people work through some of the issues that may not be grounded in fact. They may fear things that should not be feared. And through a structured program of increased activity and attempting them, you lessen their fear and they're able to progress. It's a great program. Bart Jones and Don Cassano are owners of Elite Physical Therapy. They have a staff of highly trained physical therapists that are an integral part of injury management services. I personally think that Bart Jones was around and treated Moses' knee when he crossed the Red Sea, because he's treated everybody in central Louisiana. And if he hadn't treated you, he treated one of your relatives. Everybody loves Bart. Don Cassino, Don works extremely hard at improving his knowledge and his skills, and he's recently become board certified as an orthopedic physical therapist, an OCS. To my knowledge, he's the only one in central Louisiana. Both have their doctorate degree, their DPT in physical therapy, and together they work hard to build a premier evidence-based care center that strives to establish itself as one of the providers of choice for non-operative and post-operative musculoskeletal disorders. They give each person that comes here questionnaires on their perception of abilities at the point that they're entering therapy. At the conclusion of therapy, they reassess them on their perception of abilities of how they feel they have improved to hopefully match the objective data that they've collected as part of their discharge summary. They also evaluate how the patient felt about the staff that worked with them. This data is collected and reviewed by both owners, and they're continuing to make improvements in quality care for their patients. Elite is comprised of 10 rehabilitation specialists with over 100 years of physical and occupational therapy experience. Elite assigns you to a team of a physical therapist and a physical therapy assistant, and they work together, and you have the same people, same therapists seeing you day after day after day that is familiar with your injury, your care, and progresses you to ensure that you improve. And when you come to Elite Physical Therapy, you're assigned to a team of physical therapists and a physical therapy assistant, and you see the same people day after day after day that is familiar with your medical condition, familiar with your treatment plan, and they progress you back to your highest level of functioning.
No, that's fine. It's only like the whole hour and a half. Was it the hour and a half? Like you want me, is it a lot of starting and stopping through the whole hour?
No, that's like the end's the only time.
Yeah, that's fine.